All right, so today I'm going to be talking about something that I know a lot about both personally and professionally, and that is alcohol abuse. And even though this might not be something that you struggle with, there's a very high chance that you know someone who struggles with alcohol. The clinical term for this is alcohol abuse disorder, and it's estimated that roughly 13% of men have this disorder. That's over 16 million men. So this is probably relevant to you in some way. The three things that I want to talk about today are one, how to do your own self-assessment or assess somebody else. Two, what the initial treatment process can look like, the different levels of care. And then number three, what long-term recovery will look like. The first flag that I want to plant is that I'm not trying to teach you to clinically diagnose anybody, but there are very important common sense markers that a lot of people miss with themselves and others because they're not informed. And this can be especially tricky because alcoholism is the only disease that tries to convince you that you don't have it. Self-delusion is a side effect. So whether you're trying to sort this out for yourself or you're trying to convince someone in your life that you think they have an alcohol problem and you're feeling resistance, that's probably what's going on. One of the first general ideas that I'd introduce to you is that normal drinkers don't get questioned about their drinking because it doesn't produce negative side effects. And when I use the word normal, what I'm talking about is people that do not have mental processing issues around the relationship to alcohol that people with alcohol abuse disorder often have. For instance, my mom likes to have a glass or two of wine with dinner sometimes. My guess is that she averages drinking once a week. No one in our family and none of her friends have ever questioned her relationship to alcohol. She doesn't have negative health side effects that she's facing. She doesn't get drunk ever, and she's able to control it. That's what I mean when I say normal drinking. It doesn't appear that she's trying to cope with some underlying mental health condition or event in her life. So back to my point, normal drinkers don't get questioned about their drinking. They also don't have any doubts about their own drinking. The spontaneous question, do I have a problem with alcohol? Probably doesn't come up if you manage it well. But again, I'd side with the people closest to you if they are questioning it more than what your own self-assessment is, because it's possible that you could have a bit of a delusion here. It's your safety blanket or your medicine, and you don't want to let it go. It should be pretty easy to spot a hardcore alcoholic because they've probably lost just about everything. Most of their relationships are in tatters because of alcohol. They've probably been arrested. They've done a lot of stupid shit. It's causing health issues. It's easy to identify them. In all of those cases, inpatient treatment is probably what they need. And I'll talk about that later. The most difficult people to assess are the high bottom alcoholics, the functioning alcoholics, the people that are able to basically keep their life together, at least enough to keep drinking. And I know that there are many different reasons why people drink, and that will inform the level of care that they need. I'm not going to go into all the different versions, but I do want to talk about the most common version that I see. What I see most often is men who are fairly successful in life, high achievers, high energy, that haven't learned to cope with their relational and emotional stress. And so they use alcohol to soothe their nervous system. And they will often go through rounds of their alcohol use going down and up, depending on what's going on in their life. Sometimes they may start to drink a bit more. They might notice that it's getting out of hand. And so then they'll scale back a little bit. And this, unfortunately, gives them some sense that they have control over their drinking. But in reality, it would be nearly impossible for them to not drink alcohol altogether without a serious wake-up call. It's like a toxic ex-girlfriend that they keep going back to. And what can be so frustrating and sad about people in this category is that they may never see it. They may keep burning bridges, failing to take care of themselves, choosing alcohol over other values, and basically trying to numb themselves out as much as possible. They enjoy being drunk or tipsy more than they enjoy being sober. Their natural state can actually be quite painful. And I feel for these people because I would guess most of them have traumatic experiences in their childhood. They didn't end up this way all on their own. So the next logical question is, what do we do about this? If you or someone you know is struggling with alcohol dependence, what are the options? I worked for drug and alcohol treatment programs for about 5 years. I was then trained as an interventionist. I worked for sober living programs, and I was very involved in the recovery community for many years. So I know how this process goes. Here's my general theory on how alcohol dependence should be treated. First, I have bad news for some of you. If you've dealt with alcohol dependence, sobriety, complete sobriety, is probably the best option. You may never be able to have an honest relationship with alcohol ever again. I've been sober for 18 years and I still think it would fuck me up. And I don't regret making that decision. And that is still my plan moving forward. I have heard hundreds, and I'm not joking, maybe even thousands of stories of people who thought they could go from being sober to normal drinking and it not working out for them. But I've never, and I know there might be some people out there, but I personally have never heard someone say that they regret getting sober and staying sober. It's just a better way to live. Even if you've never dealt with alcohol dependence, there really are no positive health benefits to drinking alcohol. We can make a case for other substances, but alcohol is not one of them. And actually, I take that back. I did read about a study of women over 50 drinking 1 glass of red wine a week. And somehow I think that was beneficial, maybe because of the antioxidants. That's kind of a side note, but that's not most people. Okay, so let's get back to the plan. And this is similar to how a doctor may look at treating anything, which is that you need to find what level of care will be effective. And sometimes that takes some experimenting. And if a lower level of care does not work, then you increase the level of care until it does. So, for example, with drinking, the lowest level of care might be to just try to do it on your own. Try not drinking for a month and make sure that you tell someone or multiple people what you're doing so that there can be some accountability there. So, if you fail at that, the next level of care might be going to see a therapist or a psychiatrist or attending some AA meetings. They're all over the country, they're free. Now you're building in some professional opinions and community accountability and education. Now, if that doesn't work, you have things like intensive outpatient programs where you may attend 3 hours a day, 3 days a week. You'll have a case manager. They might do alcohol screenings, drug screenings. They have portable remote breathalyzer devices that you can try. That's the next step. And if that doesn't work, you probably need to go to inpatient treatment. Sometimes people will go through multiple rounds of the lower levels of care. But seriously, if none of that works, I'd highly suggest looking at an inpatient treatment center for alcohol. The minimum length of program is usually 30 days, but a lot of them are 60 to 90 days. They are expensive, the private centers. They are restrictive. You have to be willing to completely detach from your life to get help. It's often very structured, and it should be treated with seriousness. Again, looking back at my 60-day inpatient treatment experience, I didn't really like it. I wanted to do whatever I wanted to do whenever I wanted to do it. That's not how it worked. And the irony is that the fact that I didn't like it was actually pretty motivating to not ever go back. I didn't want to go through that experience again. And you shouldn't either. I've worked for treatment programs where some people have been through 8, 9, 10 times or more. And it's almost just like a vacation. And some of these programs are pretty cush. But the general idea is that you will get out of it what you put into it. And it should be a bit demoralizing when you really realize how big of an impact your drinking has had on you and the people around you. It's a good kick in the nuts. I realize that some of you might be like, I'm never going to get any help for my alcohol use. It's not really a big deal. I don't agree with 100% sobriety as a lifestyle that would work for me. That's fine. You can disregard what I'm saying here. This is just for the people that are really motivated to change their relationship to alcohol. And maybe this will help you understand someone in your life who is struggling with alcohol. Now, the good news about the recovery process is that it does get easier. In AA, they give out chips at 30, 60, 90 days, sometimes 6 months, and definitely at a year. And I would say a year is the first major milestone in recovery where you can actually look back on the last year and reflect on what has really worked, how much things have improved, and to get a sense of what life can look like without alcohol. Because you probably will have to change some of your relationships, maybe even let go of some, and the places that you used to hang out. And just because you make it a year doesn't mean that the journey is over. It still takes maintenance. Those neural pathways that were created in your brain when you even think about drinking alcohol are still there. They're just dormant. And so you can still get triggered into wanting to drink. A lot of this has to do with your environment. I could probably do 10 more episodes on all these different factors, but most people have their head above water at a year. And then it's more about how to manage your daily stress, understanding any high risk environments that you may be in, and consistently working on the right boundaries that are going to work for you. So to sum all of this up, if you are questioning or being questioned about your alcohol use, it's worth paying attention to. You may have some level of self-delusion going on. 2, if you are going to get help, do it the right way. Get educated, keep trying things, and don't give up if a lower level of support and care isn't working. Be honest with yourself and increase your level of treatment. And number 3, long-term recovery is possible. And there's a high chance if you stick with it, your life will be more fulfilling, more honest, more clear. Full transparency, if you couldn't tell, I'm an advocate for complete sobriety as far as alcohol goes, and I'm not afraid to share that. I don't judge people who drink alcohol, even who are drinking heavily. I get it. I've been there. But way too many people are pretending that this isn't an issue, or they're minimizing the issue. It is a major problem, especially with men. Men struggle with alcohol at twice the rate of women. If you want to numb out, go ahead, but don't expect others to trust that you will be there for them when they need you, because sometimes you won't be available emotionally and physically. So if you are on this journey, I wish you the best. Or if you're just thinking about starting, I applaud your openness. And if you disagree with anything I said, that's fine. I'm open to hearing it if you want to get in contact with me. I'm also open to doing treatment consulting on the side if somebody needs help. That's all I have for today. I'm Bryce Bauer. This is the Relationships Made Simple for Men podcast. I'll see you next week.